Hello, our esteemed viewer. Welcome and thanks so very much for having a little time to view our program on this channel, Moxie Media. Moxie Media is established on the premise of making adequate research on a particular controversial issues, finding potholes and filling it up with necessary suggestions. Our aim is to purport ways for a progressive living in the society, as happiness is not negotiable to any. This is our maiden edition, and our topic for today's discussion is COVID-19 and the reality. We have some scholars from Regasm 09 who will be doing justice to today's presentation. Regasm is a coinage from the Latin verbs Regina Apostolorum Seminarium. This is a 2009 graduating set of Queen of Apostles Seminary in Afarabong, Abak local government area of Akwa Ibom State. We have one scholar in our studio today, and we have others that are on standby. Here with me in the studio is Christian Epudum. Christian Epudum is a master degree holder in philosophy from University of Port Harcourt. He is a specialist in biomedical ethics. Epudum, I must confess, it's a rare privilege to have you in our studio. You are welcome.
It's my pleasure. Thank you.
Thank you very much. It is very grievous that this dreaded pandemic, COVID-19, has affected virtually all the sectors in our society. Have you been trailing on the government activities? Their plan to cope this crisis. What will be your view on this issue, sir?
Since the outbreak of the coronavirus pandemic and its subsequent declaration as a universal health emergency issued by World Health Organization, the governments at various levels have taken meaningful proactive measures towards containment of the coronavirus pandemic. It is important to mention that some of these issues, beginning from the commissioning of the Presidential Task Force by the federal government of Nigeria, has gone a long way to bring positive impacts on the lives of the citizenry. The Presidential Task Force, charged with the responsibility of managing the affairs of the coronavirus in terms of active surveillance, early detection, case management, and isolation. It has gone a long way to help abate the continued increase of the confirmed cases of the coronavirus pandemic. And in terms of the coronavirus pandemic, NCDC has formulated various meaningful guidelines and policies, including wearing of face masks, introduction of the social distancing, introduction of limited capacity of public gatherings, and also NCDC has organized several orientations, outings in the villages and interior localities and communities. These are aimed at giving the people, the populace, general masses, the orientation on how to contain the coronavirus pandemic in terms of understanding the meaning, the effects, and the possible grounds for protecting individuals against the spread of the coronavirus.
Christian, it is very, very obvious that government are doing very well to curb the prevalence of COVID-19 in our society, but despite these their policies, COVID-19 cases in our country seem to be on the increase. What can you say about this?
Well, primarily, I would say that one of the major factors responsible for the continued increase of the number of cases of coronavirus is that people at first do seem not to so much believe in the real existence or actual existence of the disease. And this has gone a long way to make them recalcitrant to the instructions and guidelines given by the government. And once these have been done, it becomes very possible for the disease to continue to spread, and this has constituted majority of the problems the government is facing towards curbing the menace.
I feel that people are just ignorant about this COVID-19. That is why government has given policies. Some people are recalcitrant to following the government's directive on COVID-19. And as far as this platform is concerned, we are basically involved in educating the people on this particular pandemic in our society, that is COVID-19. And I want to bring in a health practitioner, Patrick Otong. Patrick Otong is a professional when it comes to health. He has a huge knowledge there. Patrick Otong, thank you very much for joining us. It is a privilege to have you in our studio today.
Thank you, Mr. Anthony.
Can you educate us a little about COVID-19 and its preventive measures?
Thank you for the question. COVID-19 is a viral pandemic disease originated from China in 2019. It is otherwise known as coronavirus. Mode of transmission. Coronavirus is an airborne disease. It is transmitted through human contacts. Could also be transmitted through contaminated objects. Signs and symptoms of COVID-19 includes cough, nausea and vomiting, sore throat, diarrhea, high fever above 38 degrees Celsius, shortness of breath. Ways of preventing coronavirus or COVID-19 includes wearing of face mask, using of hand sanitizers, proper washing of hands with water and soap, preferably through the running tap, avoidance of close contact with sick persons that are suspected to be tested positive of COVID-19, proper distancing from one person to another. Could be advisable when coughing or sneezing, you cough into your elbow. This will help prevent the virus from getting in contact with the nose or mouth.
Thank you very much, Patrick, for such an eloquent response. Governments have been trying their very best to see how they will protect lives of our citizens in the face of this COVID-19, but people are not just willing to follow government directive. I'm talking about issue of wearing face masks. There are a lot of people that have taken this thing for granted. They are not just wearing their face masks. What are the measures governments have put in place to deal with people with such insolent attitude?
Well, we recall that initially one of the excuses offered by the generality of the populace was in terms of difficulty in financing the acquisition of medical face masks. But along the line, the government came up to say that we do not have to depend on medical face masks. NCDC specifically recommended use of non-medical face masks made from fabrics, which could go a long way to prevent the spread of the coronavirus. Yet, many have remained recalcitrant and adamant towards complying to the guidelines offered by government. And governments, in its proactive measures, have, in some sense, empowered the security agencies to go into surveillance, arrest, detention, and quarantining of all those who are found wanting in terms of complying to the directive of the NCDC.
It is always said that if you are not informed, you are deformed. So we have Emmanuel Thompson, who is on standby, who is going to tell us what the media are doing in creating the awareness about the prevalent cases of COVID-19.
Yes, thank you, Anthony, for having me on the program. I would like to say that the place of the media in terms of the coverage of COVID-19 is undeniable because the media is considered the lifeblood of every vibrant democracy, channel or medium to which truth is disseminated, factual information is disseminated, awareness is created, information correlation is achieved. So I want to say that the media has gone extra mile to make sure that they create the awareness needed, produce the needed content to be able to propagate the effects of COVID-19 on us as a country, on our economy, on the healthcare system. They have gone as far as producing program segments for COVID-19 in almost all ramifications.
Thank you for joining us on our show today.
Thank you for having me on the program.
Some time ago, the governor of Akwa Ibom State, His Excellency, Mr. Udom Gabriel Emmanuel, came out to say that a lot of people are there in isolation center and are taking their medication, and it becomes obvious that these people do not have any symptom. I think that can discourage people from believing that COVID-19 really exists. What can you say about such scenario?
Well, it is commonplace for people who do not have much awareness, education and learning to doubt the possibility of people living with some disease and yet exhibiting no symptoms in them. I wish to state categorically clear that the governor of Akwa Ibom State, Udom Gabriel Emmanuel, is not mistaken to have stated that some persons were tested positive to the coronavirus pandemic, and yet there were no symptoms in them. Medical practice has made us understand that people could live for a relatively long period of time with several diseases and yet remain asymptomatic. You know, symptoms of diseases usually emerge with time depending on the nature of the disease and as well dependent upon the nature of the immune system of the particular individual involved.
Patrick, in our conversation, Christian just mentioned the word asymptomatic. I would want you to explain that word to the understanding of an ordinary man in the society.
Okay, Anthony. The issue of coronavirus or COVID-19 being asymptomatic is simply the patients being tested and confirmed a positive carrier of coronavirus without displaying any of the signs and symptoms I earlier stated. In such case, the person is being confirmed without displaying signs and symptoms. That is the nature of COVID-19 being asymptomatic. Thank you.
Government has taken to the pages of newspaper, the screens of television about their painstaking effort in providing basic equipment in the hospital that will help to manage COVID-19 cases. What can you say about these developments?
Thank you, Mr. Anthony. I want to thank Mr. Udom Emmanuel for the effort he has put in Akwa Ibom State. In fact, when we mention about states that have worked tirelessly in tackling this deadly pandemic in the society, apart from the Federal Capital Territory, Abuja, Lagos State, I think we can be proud to mention Akwa Ibom State as one of the states who were really prepared as if they knew this coronavirus will come to stay this while. Come to mention them, the well-equipped isolation center there in Oran with above more than 300 capacity beds. That has really helped in tackling this pandemic virus that has been our problem for the past 6-8 months now. We have other places like IDH, Ibom Specialist Hospital is there still to control this menace in the society. So I want to really commend the government officials, the NCDC, for the work done in tackling this deadly virus in the society. And with God, we believe the menace is going to have an end in Akwa Ibom. Thank you. very much for being with me today.
Thank you very much, Patrick. Back to the studio. Christian, of recent, it has been announced that the school will be reopened for students in JSS3 and SS3 to write their external examination. Are you in support of this move?
Examinations or education as a whole is a top priority for any nation to progress and develop. And it is basically from this impetus that the government has made it clear that they will be opening up schools for exiting classes to take their external examinations. I would really support this move because if you have been following truly on the activities of government, the government does nothing arbitrarily. There have been several phases of the reopening of the economy, right from phase 1, second phase, third phase. What we have now is a consequence of a very critical analysis by the experts who are concerned with managing the coronavirus pandemic. You could recall that there were several guidelines put in place for reopening in the first phase. There were other guidelines following the second phase. I want to state that it is no issue of concern whether there will be risk of spreading the virus when schools are reopened. And of course, all other aspects of the economy, the markets, the churches are already open, normal activities are resumed. So I see nothing stopping the students from going back to their classes for examinations and other educational formalities.
If they should go back to classes, there should be proper measure to check whether these people are keeping to the guidelines or the directives given by the government. Thank you very much. We appreciate your time in gracing our red carpet today, your eloquent contribution, and all those that are on standby, thank you for having a lot of time to usher in your contribution to this program. Today's topic was COVID-19 and the reality, and this is EP Moxie Media. Our aim, like I said before, is to purport ways for us to make a progressive living in a society. We make research, we discuss on controversial issues that are taking the length and the breadth of our country, Nigeria. This is how far we will go for today. Subscribe to our channel, EP Moxie Media, so that you get notification on our next production. Thank you. Have a wonderful time with your people. Bye.